Thank you. I'm looking at my screen and seeing 1 minute past 7, but perhaps my machine is slow or I'm too quick. I don't know. May we have any apologies and notification of substitutes?
Thank you very much, Chair. So apologies tonight from Councillors Khaled and Parker. We have Councillors Kerry and Roberts-Thompson substituting. Otherwise in attendance we have Councillors Sue and David Bagshaw, Councillor Crowe, Councillor Eason, Councillor Stephanie Kerry, Councillor Pat Lally, Councillor Hannah Land, Councillor Richard McRae, Councillor Greg Marshall and Councillor Simpson and Tyler, obviously, in the chair. I also think that we could have Councillor Miller-Mardulovic as ex officio.
I am chair.
Thank you for that confirmation, Councillor Mardulovic. As for declarations of interest, I haven't had any confirmation of declarations of interest unless other councillors would like to do so now.
Hi, Jeremy. We've got the usual one that we are board members of Liberty Leisure, so I think we've dealt with that, but just to reiterate that.
Thanks,
Thank you.
Councillor Eason. No items relate to Liberty Leisure on the agenda this evening, so it shouldn't be necessary to declare that interest, but perhaps you'd like to if the need arises. And other than that, it's back to you, Chair, for the minutes.
Thank you, Jeremy. We move on to the minutes of the previous meeting. If you look at page 1, and please indicate if there are items which you wish to query or make comments on. So page 1. Page 2. And page 3. There being no questions on that, I am now going to suspend the meeting. So
Sorry, Chair, could we just take a vote on the minutes, please, if somebody could propose and say.
I beg your pardon. May we take a vote on those being a true and accurate record of the minutes?
I'll second that, Chair.
Are you proposing, Chair?
I propose. I beg your pardon.
Thank you very much. Councillor Sue Bagshaw.
4.
Councillor David Bagshaw.
4.
Councillor Crowe.
4.
Councillor Eason.
4.
Councillor Stephanie Kerry.
4. 4.
Councillor Lally.
4.
Councillor Land.
4.
Councillor McRae.
I have to abstain because I wasn't at the last meeting.
Thank you. Councillor Marshall.
I'll abstain because I wasn't present at that meeting either.
Okay. Councillor Simpson.
4.
Councillor Tyler.
4.
Councillor Eric Kerry.
Abstain. Wasn't at the meeting.
And Councillor Roberts-Thompson.
I'll abstain because I wasn't at the meeting either.
Thank you. That's carried, Chair.
Thank you, Mr. Ward. Okay, now we move on now with a suspension for a statement by the Chief Executive. Ruth, if you would, thank you.
Thank you, Chairman. I think what you intended to do was to suspend standing orders to enable there to be an update on the latest situation with regard to COVID-19 rise in positive tests in Broxtowe.
That is correct.
So with the necessary formalities of that being done, i.e. the consent of the meeting, I will proceed to give you an update.
Does the meeting so consent?
Agreed.
Agreed. So there has been an update in the rate of COVID-19 positive tests reported in Broxtowe in recent weeks. And the rate of positive tests is significantly higher than the national and regional average. The areas of most concern in Broxtowe have been Kimberley, Watnall, North Beeston and Eastwood. The main locus of infections has been within households and some household clusters. Some have been linked to an event which took place within a public house in the north of Broxtowe. Weekly incident management team meetings chaired by the Director of Public Health have been held with public health colleagues, NHS colleagues, colleagues from the CCG and Broxtowe's own employees, including representatives from communications and environmental health staff, as well as myself. Various interventions have been agreed at these meetings. These include targeted communications in areas of most concern, systemic contact tracing supplementing what is available nationally, provision of advice and guidance on a one-to-one basis as part of the contact tracing effort, work with Nottingham University on local outbreak planning, coordinated enforcement activity with the police in public houses and microbreweries, particularly in the north of Broxtowe, provision of advice and guidance to businesses, the use of powers such as the serving of an improvement notice and a community protection warning letter to ensure that non-complying establishments improve their safe operating practices, the making of a video to encourage safe use of town centres, and the deployment of local mobile testing facilities, which are, as you may know, subject to national constraints and difficulties. The situation is being closely monitored through the local outbreak board, as well as on a very regular basis, until now, weekly, by the incident management team. Thank you, Chair.
Thank you. Are there any questions or observations which members wish to make? Councillor Radulovic.
Chair, in support of what the Chief Executive said, and I realised that she's under constraint by Public Health England about some of the information that's given out. It equates to over 80 positive tests with an infection rate just under the 40% 40 level, which is, as you say, much higher than the national average and higher than the regional average. A great targeted leafleting is particularly being looked at in places like Eastwood, and a borough-wide letter will be going out as well, borough-wide information, as well as targeted leaflets to particular households, especially in Eastwood St Mary's ward. Whilst most of the outbreaks have been identified as being a household spread, we are concerned about the rises in particular regarding schools, especially in the north of the borough. There have been several incidents have reported on social media, and this seems to be provoking quite a vociferous response from members of the public about standards and safety and operations within leaving school premises, queuing outside, and of course gatherings in the town centre. Chair, I'm here to answer any questions if anybody wishes to ask any, but we are extremely concerned that continued rises in the COVID numbers and infection rates will result in us being placed on the government's watch list. After that, if numbers continue to rise as they have been doing in recent weeks, then we fear that we may be part of a localised lockdown. And as consequence to that, Chair, that would have devastating impacts for businesses across not just the north of Broxtowe, but the whole of Broxtowe. We're trying to avoid this by targeted communication and asking people to adhere to those, and all members can actively be involved in helping to spread that message as far and wide as possible to as many members in the community as possible. And we are formally request all members to do what they can to spread that message to enable us to defeat the COVID outbreak.
Thank you, Councillor Radulovic. Anybody wish to ask any further questions on this update?
Could I just make a comment, Bob, Pat?
Carry on.
Yeah, sorry, I wrote on the chat.
Yes, please speak,
Yeah.
Councillor.
Thank you, Ruth, for that update. Thank you for the work that you're doing on it, and I support any actions that you feel you need to take. Go as far as we need to. It really is disappointing that we're being highlighted as an area of high infection. You know, we are a good borough, a good area. At the end of the day, well run. However, I mean, I know one of my own neighbours. She's not doesn't seem to have much control or requirement to control people who are coming to and from her house, and yet she states on Facebook then that she daren't send her children back to school because it's not safe. Some people just don't seem to understand what is going on and what we need to do at this moment in time.
Thank you, Councillor. Mel Crow, do you have a question?
Let me get rid of that.
Thank you. It's just a question regarding the targeted leafleting that the leader referred to. It was indicated that it would be to particular areas, but didn't seem to encompass all of the areas the chief executive referred to. And I just wondered why that was, but also wanted to query, will the council be using the email list through the Broxtowe Email Me to ensure that the message is targeted to a wider audience that extends across the borough and isn't just targeted at the places referred to by the leader, so that spreads the message far and wide? And will we also see an increase in the visits to local public houses? I appreciate that local public houses, like every business, need to make a living and have suffered as a result of the lockdown. But certainly from reports that I'm receiving from residents since the rules changed at the beginning of this week, we are not seeing within Kimberley still, in certain public houses, I'm informed, the level of compliance that it was intended by the government. And there is an ongoing concern in Kimberley that this isn't being policed effectively by our environmental health team. Thank you.
Thank you, Councillor Crow. I have a request. Greg Marshall, please.
Thank you, Chair. I just wondered if the leader and chief exec could outline what the trigger points would be for a intervention from Public Health England to enforce a lockdown. How far are we away from them? What would they look like?
Please respond.
So on the points that have been raised, we use a variety of communication mechanisms that will include the Email Me service. We will be targeting messages at all subscribers in exactly the manner that Councillor Crow suggests would be effective. That Email Me system covers over 20,000 households. On top of that, there are some targeted communications aimed at the areas where our current rates of positive tests are highest at the moment. Those relate to some areas of Beeston and some wards in Eastwood. We will use our email database to issue general communications, and all our social media channels are continually sending out the messages. In terms of the trigger points, normally, this is a matter for Public Health England. I'm not an expert on this subject, and I think it would be misleading of me to pretend that I am. And I think that the point at which Public Health England or the government will intervene in any one area will depend on a variety of factors, not just rates of infection, but relative rates of infection, i.e., there are other areas of the country at the moment which show much higher rates of infection than Broxtowe. So I would not want to alarm the public at this stage. I think the message simply needs to be that we are carefully monitoring the situation, and that interventions and action have been agreed and are in the process of being rolled out. On the question of enforcement of the new regulations, I can assure Councillor Crowe that the police are visiting regularly, as are our own environmental health team. And where concerns have been highlighted, action has been taken. So I quoted 2 examples where one improvement notice has been served, one community protection warning notice has been served, and a licensing review is currently being undertaken in another premises. So there is a very active approach to enforcing the regulations, and we will continue to take that approach.
Thank you, Ruth.
Chair, I asked to come in after Pat Lally. It seems I got forgotten, which is surely a mistake on your part from your fellow.
Well, probably is. I've got a mixed screen here at the moment, so I'll take your question next, followed by Councillor Eric Kerry and then Shane Easton. Thank you.
Thank you, Chair. I'd just like to echo the thanks that have been given to Ruth and to Milan. I know they're putting in an awful lot of hours dealing with this pandemic, as are a lot of people across the country. I think that the council is right in the actions that it's taking. The balance between causing alarm to the population that we serve and enabling keeping the population safe is a fine line to draw. The numbers are very worrying, the numbers are rising, and that is concerning, and that is, action needs to be taken to try and stop us getting further cases as much as possible. As I would hope, as we see some restrictions having come in this week, that might take effect over the coming weeks and numbers might go down, but we cannot rest on our laurels at all. We need to be getting the messages out there that the public need to be limiting their contact with people. Hand washing, mask wearing, absolute key to defeating this virus. Hand washing is absolutely the best barrier you've got to this virus. I can't emphasise it enough. I'll just also speak from a hospital point of view, as I work at the Queen's Medical Centre. So far over the summer, whilst the numbers have been rising in community-acquired COVID cases, we haven't seen the effect drifting into our hospitals, but that is the danger we face as we go into the autumn and winter season, particularly for our old population. So I understand from the figures I've seen so far that it's affecting more of a younger age group at the moment, but the risks are still there for our older and vulnerable people, and we need to make sure that action is continued to be taken by the whole of Broxtowe in order to try and defeat this. And finally, I'd just say that it's right to point out that Broxtowe isn't in the highest numbers in the country, and the general trend across the country for COVID numbers is unfortunately a rise in infection rates, which is to be expected given that the schools have gone back and other issues. It's a real challenge and a balance to keep the economy in the country going in the midst of this. So I just want to say thank you to the council and the officers for all their hard work trying to get the messages out and trying to keep us safe. Thank you, Chair.
Thank you, Hannah, and I'm sure we all endorse those comments. I noticed David Bagshaw wants to speak, but I have two more to go through. Councillor Eric Carey, please.
Yes, thank you, Chairman. I just want to support the work being done by the council and everybody else that's involved in trying to contain this possible second wave. Again, we mustn't be scaremongering in terms of what we do. Just one clarification. When Councillor Radulovic spoke, I thought he mentioned 40%, and I wasn't quite sure what he meant by that. As far as I'm aware, it's 40% of 40 out of every 100,000 cases, not 40% of people that have been tested being. So we need just a bit of clarification on that, please.
No, you don't. I did correct myself, Chair. It is 40 per 100,000. That's the measure of infection rate that Public Health England uses.
Thank you, Councillor Radulovic. Okay. Councillor Shane Eason.
Thank you, Chair. Ruth's answered part of it now as the enforcement issue. I'd like to sort of echo what Mel said with the pubs. We appreciate the businesses and everybody's got to make a living, but I think it's an easy target for people to see over the bank holiday weekend that's not been that far gone. There were two pubs in Kimberley. Well, one in Kimberley, I've not mentioned it, but Kimberley and Horsworth. One had got bouncy castles outside and an outside music event going off, as had another one of them in Kimberley with crowds of people outside. Those sort of things, we say we are cracking down on that, and we're doing certain things. I hope we are for the reason that, again, it's like a lot of things, it's one of the few things that people can actually identify and see. So if you're driving down the road going shopping and you see a pub full of people at a music event and bouncy castles, it certainly isn't adding to the feeling that we should all be isolated, washing our hands, etc. So again, I would just hope that when we say we are working on these establishments, that we really do bring this in control, because unfortunately for them, they are a very visible part of our community that people can see and can pass comment on. It's not quite so easy in your front room or other places, but they are very visual things. I do think, we need to have a real crackdown on it. Thank you, Chair.
Thank you, Councillor. If I might just come in for a moment there, and perhaps the Chief Exec can give me some guidance. I understand the police have now got enhanced powers. Can you just clarify that for me?
I will just say, in relation to the effect of spilling out into the public area, the police have got dispersal powers, which they both create and use, and I understand have been using in relation to those sorts of behaviours. The police are very much mindful of problems that are occurring outside of the pub premises. I think the other thing to say is that the ultimate powers for closure have now been enhanced through new regulations under the Coronavirus Act, and these can mean that certain premises can be closed by order of the Director of Public Health. Normally one would expect a course of action leading up to the use of those most severe measures. So what we have been doing in relation to the serving of notices and letters and so on, and giving of advice and sending information, warning people about compliance with the rules. All this would be evidence that we have tried all other reasonable steps. And if non-compliant behaviour continues, then in those circumstances, the use of the closure powers is now available to us and would be used, but would have to be used through the order of the Director of Public Health under the new regulations.
Thank you, Ruth. Councillor David Bagshaw.
Yes, thank you, Chair. Councillor Radulovic, in some of his summing up for Eastwood, mentioned that they was particularly worried about St Mary's ward. I think it's pertinent that I should be informed as the ward member, which doesn't seem to have happened. But my request is, what can I do to help in my ward? Thank you.
Thank you, Chair. What can be done to help is the repeating by all members of exactly what Councillor Land said about hand washing, social distancing, compliance with the rule of 6, maintaining responsible behaviour, and sticking to that rigorously. And councillors need to keep repeating that in their communities, on their social media channels. Those are the measures that will help to reduce the spread of infection. I am, able to give you only as much information as I'm allowed to through the Director of Public Health, and we are devising a new set of communications for members of the council to keep them informed as best we can. So we will do our best to keep members informed. I think members were all informed yesterday about testing arrangements in the north of Broxtowe.
Thank you, Chief Executive. Are there any further questions on this item? In which case, I'll move back to the agenda item, the next one being the business plan review and progress, pages 5 to 12. And I think I'll go through those page by page, and you can raise comments as you see fit as we progress. And this is a request to consider progress made in achieving the key tasks and actions in the health business plan. So we look at the background paper, page 6. Page 7 gives the clarification of what the various symbols mean. So then we move to page 8.
Chairman, could I just make a couple of corrections to page 8, if you don't mind? Mention is made of 100% progress on the youth action plan. That in fact is not correct. The youth action plan work hasn't made that amount of progress. It has been difficult to progress that because of COVID at the moment. So that is in error. The Child Poverty Action Plan is actually going to the next policy committee at its meeting, because by a quirk of the terms of reference of the committee, apparently that is the appropriate committee to which this this subject should be addressed. And yeah, so both those points on page 8, I apologise, it's slightly wrong.
Thank you. Any further comments on items on page 8?
Chair, I've got a comment in, if that's okay.
Councillor Easton, yes.
Yeah, and that's at the top of page 8. It's the progress with the facilities. I thought we'd got the company looking at that, and I thought we were about ready for that to come drop it. Just says it, we've made no. We usually show a monitor that we're nearly there. Is it 0% just in error, and we are nearly? We're still going to get this in August, or
yes,
in August.
Yeah, I can help Councillor Easton. I think we've been really hard on ourselves there, because the really excellent news is the leisure facility strategy will be presented to the 1st of October Policy and Performance Committee. So we were very, very close to completion and submission. So that's on track for delivery to the Policy Performance Committee on the 1st of October. In terms of actually delivering the strategy, that's clearly more longer term, and there's lots of further work to do based on the outcome of what committee decides on the 1st of October.
Thank you, Zolf. Any further comments on page 8?
Can I ask a question in light of what Zolf just said?
You may, Councillor Crowe, carry on.
Why, if it's on the key tasks and priorities for this committee, is it not coming to this committee before it goes to policy and performance?
Well, I think the answer to that is that they have financial implications which they have to approve. And perhaps we'll put in larger funds.
I think that the answer is large, complex strategic projects that touch all the different parts of the council tend to go to the Policy Performance Committee. And we did the same with the report back in June. We had an extraordinary Policy Performance Committee to look at the outcome of the report, interim report by continuum. We did that because of the financial implications, the HR implications, as well as service delivery implications. So it touches everything the council does.
Thank you, Zol. So moving from page 8, page 9. Any comments on the 2 items indicated there? Page 10. Page 11.
Yeah, oh, sorry, go on now.
Just a couple of queries on that. So relating to the 2 things that are in red. So the first one, the high-risk licensed premises. Are we really saying, now we're heading towards the end of September, that there have been no inspections undertaken due to COVID-19? Is that really still the situation, particularly when it says there's been someone in place from August? I appreciate these papers may have perhaps been subject to a briefing before then. And likewise, food inspections. Are we really saying there's no proactive inspections being conducted? Bearing in mind we're in the middle of a public health crisis, I would hope not, because I would think that those inspections are absolutely key to maintaining public health. So I'm just wondering on those 2 issues.
Thank you, Councillor Crowe. David, if you'd come back on that.
Certainly, thank you, Chair. Yes, the 2 points have been made. The licensed premises, it's not that no inspections are being carried out to licensed premises. It was just that particular indicator is where there's been a change of designated person in the licensed premises, and they have been put on hold because the priorities have shifted. As was pointed out earlier, the enforcement officer who's recently joined us has been undertaking work based on the COVID issues, and that particular indicator, therefore the work on that has been put on hold. In terms of the food hygiene inspections, the routine inspections have ceased, and that is on the guidance and instruction of the Food Standards Agency. It is starting up again as things are, well, going back a little bit towards normal. We're far from normal at the moment, and the environmental health food team are involved in a number of COVID-related issues regarding how pubs and other places are carrying out their duties in terms of social distancing, taking names and addresses, contact details, etc. We are awaiting further guidance from the Food Standards Agency, but there is an expectation that they will be realising at the end of the year that local authorities will be nowhere near 100% of their inspections as we have been in the past. Thank you, Chair.
Thank you, David. So we're complying with the Food Standards Agency and we are working in accord with the government's direction. Is that correct?
That is correct, Chair, yes.
Thank you. Any further items on page 11?
Oh, Ian, sorry, could I just come in?
Yeah.
That's covered most, but just a comment that actually bleeds over onto page 12. And that's where we've not finished things. Everything seems to have 100% target figure on it. And when we go on to page 12, so same, we're coming back again. there's four more items on there, but they've got nothing, no annual figures or anything, no figures coming in, but they're all 100%. So my concern is that just feeds into something else. So is that just a bit of a typo, or is that correct? Thank you.
Thank you, Shane. David, thank you.
Through you, Chair. What the thing with those is that they are reported annually, those figures. So there's no updates on them. They are reported annually. So it's we don't report on a quarterly basis on those. So it is 100% for the year, and that will be reported at year end.
Thank you. Okay, any further comments on page 12?
Can I just ask something further in respect to this Food Standards Agency issue?
Please do
What
so.
when did they, I'd like to know when they said the inspections needed to resume, and what their target is, what they set the percentage target. They must have issued some guidance to councils, sorry.
Okay.
Through Chair, we haven't had that guidance as yet on what they are expecting at year end. I'm guessing that it will depend largely on what happens in the next few weeks and months, because as the Chief Executive mentioned a little earlier, environmental health staff are involved in the policing of these premises, and the normal inspection regime, I say, has been put on hold. So as soon as we get something from the Food Standards Agency, we will update members accordingly on that.
Thank you for that. And Councillor Crowe, I understand the frustration, and I'm sure it's...
Please, Councillor Tyler. This overlaps with my Community Safety Committee, and talking to officers in the Environment Department. They've not been sitting on their hands. They've been contacting businesses by other methods, phone and email, and issuing advice to them, and keeping a particular eye on any businesses that have caused us concern in the past, with regular sort of contact with them. So in very, very difficult times, they've been working hard to try and ensure the safety of local residents, and as such, we don't seem to have had many sort of serious outbreaks of any serious outbreaks of poisoning of any description. I know there has been one minor one that has been followed up quite closely and identified.
Thank you, Councillor Lang. Any further comments before we move on to the next item? No, in which case we move to page 13, mental health support for residents. Now, this is a noting report, but perhaps, Ruth, you'd like to give us a little bit of background on this, and then we'll take questions.
Thank you, Chair. So our corporate plan says that we are committed to supporting people who have mental health problems. This report sets out some of the help that's available for people living in the Broxtowe area. The appendix, starting on page 15, sets out the sorts of help available through GP services, local mental health teams, and there are details about the sort of help that's available through that channel. There is a mental health helpline, which is available, and a mental health crisis helpline. The Not Help Yourself website is a self-service option where people can link themselves up with local provision. There is an extensive list of web-based contacts and details for people wanting support in that way. There is the Every Mind Matters website, which has lots of good resources to support people who use that channel. and the NHS Choices website. The web link is also provided there. Looking more locally to activity which we as a council are involved with, we run so-called complex case panels on a monthly basis. These are multi-agency case conferences where we discuss individuals who are at risk of harm or at risk of causing harm to others. And the purpose of these panels is to action plan to reduce that risk. The caseload is substantial, and the actions taken are really valuable and useful to people. Middle Street Resource Centre is is an organisation which members know, which is based in Beeston, and they very much work in the area of supporting people with mental health problems. We work with them to help and support their efforts. The Hope Centre is a centre that we also have good links with, not only in relation to the provision of food, the provision of food parcels for people, but also they have befriending services which reach out to people on the margins of society and those with addiction problems. Also, people can volunteer through the centre to help others. One more recent initiative is an initiative which this council funded through a grant of £40,000, and this is the Eastwood Mental Health Hub. It's a partnership between Citizens Advice and Mind. We do help to fund it, and it provides a range of different services for people with mental health problems. It covers a variety of different aspects of their needs. Often people with mental health problems present with quite complex and many different issues. It would be perhaps a good idea at a future meeting if you actually received a report directly from Sally Bestwick, who runs the Eastwood CAB based at Beeston, as I'm sure you will want to know more about how that work is continuing. So that is what is available for local people with mental health challenges in our area. Obviously, this recent period of the COVID experience has been very challenging for people who have mental health problems. It's often said that COVID is an immense mental health. It's left many people with severe repercussions for not just their physical but their mental health. So this whole area of focus is more important than it ever has been. And obviously this council has limited resources, and this, as far as we're concerned, is an area where we have discretion to spend money and put our efforts, but this council has chosen to invest its time and resources in supporting the mental health of local people. Thank you, Chair.
Thank you for that, Ruth, and I'm sure an address from Sally from the Eastwood Mental Health Club would be very informative, and I would like to think we can put that on the work programme for a future date. Councillor Radulovic.
Chair, one of the issues I wanted to raise in particular, following a further incident yesterday, is the rise in suicide among men, and it was a close friend of our family who yesterday took his own life, and I would like to see included within our future plans and for the Eastwood and Mental Health Hub and other groups and organisations, a dedicated targeting of young men in particular who find going to the CAB and to other groups and organisations perhaps to be something that they don't feel is for them. So I want to investigate ways in which, if the Chief Executive can take this issue forward, in yourself, Chair, and others, to look at ways in which we can try to reach particularly young men. It's now said to be the biggest, the highest death rate among men, particularly under the age of 50 years of age now, is suicide. As a consequence of that, Chair, I feel now is the time to look for some targeted and dedicated help towards those people who otherwise come forward in the normal way.
Thank you for that, Councillor Lovich, and I'm sure that the Chief Executive will look at that and we will bring it forward.
Please, Councillor Taylor, I asked to speak.
Yeah, sorry, I'm not getting all the call-ups coming on my screen, Pat,
Yeah.
so thank you for
I didn't
coming.
see where Milan came from. Anyway, he's always interesting to hear him.
Yeah.
Can I right, just regarding, I mean, I have a certain knowledge of Middle Street Resource Centre. So many organisations such as the NHS, they're engaging staff to signpost those with mental health difficulties to places where they can get support. I'd just like to say about Middle Street in a moment. We must also ensure that these organisations that provide support also survive these difficult times. It seems a bit tongue-in-cheek to employ signposting staff and signposting methods without providing funds and support for the organisations that they're signposting to. I mean, I'd just like to mention I spoke to a senior member of staff, Robert Ashford at Middle Street Resource Centre, whom I think, along with Sally, we should invite to speak to a meeting at some point. He's very knowledgeable in this area and has had a lot of experience. But from Middle Street, since reopening on 10th of August, they have seen a steady increase of numbers attending Middle Street. Some of our support groups are now restarting with less numbers as we have to follow our COVID-safe regulation. We've also seen an increase of new visitors who have come to us as lockdown has had its impact on many different people. As Ruth has mentioned, it's been devastating to some people. As mental health needs increase, the whole service is under more pressure. Say secondary services frequently signpost to third sector organisations like Middle Street. This is a concern as these services do not receive funding from any of these statutory services. As possibly with other organisations, the income of Middle Street has severely decreased, and because of COVID restrictions. And if any of these organisations were to have to close, it would have a huge impact on the support we offer to residents in our community, statutory services, and more importantly, those that struggle with mental health needs. Can I, but as an aside, thank Ruth and thank Broxtowe and thank councillors for the support that they've given to these organisations through the COVID. But please keep an eye on these organisations. We need them.
Thank you, Councillor. Ruth, would you like to?
Yes, absolutely. Middle Street provides a very, very valuable service. I will just confirm that we did give them a £10,000 coronavirus grant. So we have very much got their needs in mind. I don't know if they applied for a grant to the County Council's fund, or whether they were successful in getting that money, but I believe that money is not fully spent. So I would encourage them to make those sorts of applications on an ongoing basis.
Thank you, Ruth. I'm told that they got £3,000 from Nottinghamshire County Council, which didn't seem to be a great deal, really, considering the impact that COVID has had on them. But could I ask other councillors present and other officers to, when you get the opportunity, to say it's all right having signposting, you need somewhere to signpost to, and please, they need funding as well. So thank you for tolerance.
Thank you.
Thank you. I have to say £3,000 doesn't seem like a lot of money when you consider the valuable service that they have given. Yes, that doesn't quite seem right to me, I have to say.
Thank you, Ruth. Councillor Shane Eason.
Thank you, Ian. Ruth sort of covered what I was going to say. My concern was that money was being put towards the people who are going to be struggling through this COVID period with losses of jobs and things and that sort of thing. But you know that the £4,000 will go a long way, and I just hope that we will get there. We as councillors get to know this information firsthand at meetings like this. I just hope that we can get the information out again, perhaps through the email situation that we've got with the borough, to get the information out so people do know where to turn, because there'll be people now, perhaps for the first time ever in their life, sort of feeling desperate, that's got no history of knowing where to turn and have no idea. So I think that getting that information out to them would be really useful. Thank you.
Thank you. Ruth, do you want to come back on that?
Yeah, thank you, Chair. I think that's a really good suggestion. The information in this appendix, I can pass it to the communications team and get them to use the material in their social media and other communications. I'll do that.
Councillor Radulovic, I think you wanted to come back on.
Just to ask if the Chief Executive agrees that we can have some form of dedicated service to helping young men in particular who don't seem to want to use the official channels, and we can find a way of communicating particularly to that targeted group. The rise in suicides, particularly in places like my own in Eastwood, has been horrific over the last year. I know at least now of 6 people in the last 6 months who've took their own life by various mechanisms. So for that dedicated service, that we can target those people who are very vulnerable but refuse to use the standard service.
Chair, with your permission, I can arrange for a report on your next agenda to focus on suicide. The County Council do have a suicide lead, and we can produce some data for you on the numbers and any trends for the Broxtowe area. So we'll do a special report on that for the next meeting.
Thank you, Ruth. Noted. Any further questions on this before we move to the next item?
Yes, Chair.
Is that David?
Yes, it is.
David, please come. David, are you there?
Just a query on page 15 with the local mental health teams. Who sets these parameters that they're only covering people aged 18 to 65? What about the people before 18 and people over 65? Is this because they're presuming that from 18 to 65 you're in employment, because now people work over the age of 65, and I'm sure some people go to work before 18. I just want to know why those parameters have been set, or is the presumption that people before and after don't have mental health issues?
Chair, I think the answer as far as the lower age range is concerned is that there's a service called CAMS, the Community the Children and Adolescent Mental Health Service, and that is a specific service which is targeted at children and young people to the age of 18, so that is a separate provision for them. And it's important that the transition from childhood to adulthood is carefully managed so that people don't fall between the gaps. That's often a bit of a challenge. As far as the older age range is concerned, I'm not entirely sure what the answer to that is. Maybe Hannah knows better than I do.
Hannah, would you like to come in on that?
I'll come in on that with my background in health. So Ruth's right that for the children class who are under the age of 18 and under come under the children and adolescent mental health services, which will be separately commissioned service with different parameters and needs. I'm sure we could arrange some kind of report to be commissioned to be informed what is available for our young people in the borough. I can speak to Alex about that. And then the same is for older adults. So for adults over the age of 65, there is a separate service again commissioned to meet their mental health needs, which can be different again. So it's not that any age group is excluded or not catered for, it's just there are different services tailored to meet the needs of those different populations. I will say that the transitioning period from child service to adult services can be a very challenging situation to manage. There can often be quite a lot of input given to young people across mental health and physical services, which isn't necessarily reflected in services that are commissioned for working age adults, unfortunately, and that can need some careful management to adjust to make sure that needs are being met appropriately across the physical and mental health sector. Whilst I'm up and running on here, I'd also like to extend my condolences to Milan on the tragic loss of the friend recently. He's right, suicide rates among younger men is a terrible blight, I suppose, that needs to be addressed. I'm looking at this report and seeing the various web of services that are available in Broxtowe, and noting that a lot of these are accessed online, which can be a challenge to some people if they're not familiar with the technology or the internet. I would wholeheartedly support Milan's request for some targeted support to address the mental health needs of men and address the suicide issue. And I'd be interested to hear from some of our services about how they've been getting on during the COVID time. As we heard from Pat, Middle Street Resource Centre opened its doors again in August, and yeah, I would also support Pat's request that we look to make sure that these voluntary services are supported, because they are a lifeline for our local communities on top of the commissioned services that are provided by the mental health providers. Thank you, Chair.
Thank you, Hannah. Do we have any further questions on this particular item? Eric Carey?
Thank you, Chairman. I think it was Councillor McRae before me, but I don't mind going now. I too want to pass our sympathies and condolences to the family and friends of that young victim and suicide mentioned by Councillor Radulovic. COVID has certainly made a difference in terms of the community and people having to cope with, with being locked away. I do think it's also an opportunity to thank the councils, County, Broxtowe, the key workers, other services, and indeed mutual aid groups that have been involved through COVID on their hard work to do as much as they can during this period to help people. And I hope that that's helped things not to be even worse than we've experienced. Some of the things that have been raised really would I believe to be helped by the continuation of the mental health working group, and could take those.
Just interrupt you there, Councillor Carey. That group no longer exists.
I know.
Well, don't raise it because we're not going to discuss it.
Well, I think people have already said people have already said that some of these strands need looking at. I was wondering whether that could be reconsidered. I'd also wonder that some of the list as local help, that also the Samaritans and Mind and other national groups are also appropriate for the list produced, in that some people don't really want to have their mental health issues known in the local community and might want to go to more national or more distant help. So I just wonder if that might be reinforced too. Thank you.
Councillor Radulovic, if you wanted to
Chair, I cannot leave them remarks to go unquoted on by Councillor Kerry. We consider the issue of mental health to be far more important than a working group without any spending powers or official policy or strategy to deal actually directly with issues. It is now a full report of the committee, which we are debating in full, and has spending powers and the opportunity to discuss, debate and formulate policy regarding health at full level at committee, rather than just a working group. I think this is a big step forward and actually places things like mental health support at the top of the political agenda and not resigned to a working group which has no power.
May I just come back on that, please, Chairman? Just that, okay, so what you're saying there, Councillor Radulovic, is there will be an action plan for all these work streams within the work programme. Thank you.
It's unworthy of any further comment, Chair.
Right, I think you know what the answer to that is, Councillor Kerry, and it was a rhetorical question. Ruth, did you have any comment to make on that, or can I move on now to the next item?
Just one final comment, and that is to say that I will make sure that the communication that we send out does include reference to the Samaritans and Mind and the contact details. Thank you, Chair.
Thank you for that, Ruth. I think we've gone through all the items now. Can we?
I
think there's two people who want to speak, Councillor McRae and myself.
Oh, you're right. Hang on a second. It's because I'm not getting the call-ups on the screen. So, Councillor McRae first, and then Councillor Crowe.
Yeah, thank you, everybody. Yeah, it's a really good report. Obviously, it does cover a lot of things that's happening in Broxtowe, but I just wanted to add that obviously there's more local things. As you know, I run Stapleford Community Group, so I will declare an interest in that, just in case I need to. And we've had a lot of people I didn't realise to start with, and then people was coming to me and telling us that we've had people that's got various mental health issues. So I'm not going to say what they are or names because we're not here to do that. And a lot of people was out of work because of what's been happening, and they'd actually came to us and said, "Is there anything we can do?" And kind of there wasn't to start with, but then we made sure that there was. And we've had people collecting food for us. We've had people taking food around to other people. We've had people coming out helping with the planters in Stapleford and even gardening and just doing loads of little things. So what I was going to say is, there's a million mental health issues out there that people suffer with, all different scales of them. And I'm not an expert, I'm far from it. But I just think that, there's a lot of voluntary groups in not just Stapleford, but the whole of Broxtowe. And I think volunteering it keeps people sane. It's a brilliant thing for helping with your mental health. And things like walking groups as well, like that. So if there is something going to be put together, I'd definitely like to have a little bit of input into that, because I know there is other groups in Stapleford, like the Helpful Bureau, for example. There's lots of other groups out there doing stuff, and I'm more than happy to put something together of what some of us have been doing in Stapleford. If someone tells me who to send it to, I'll happily sit next to a computer for an hour, put something together, and whiz it across. And you can use it or not use it, but I do think we need to realise the importance of volunteering, and I'll just say thank you to all the volunteers, and this has even included officers that's been volunteering their time throughout this, so I just wanted to say thank you, and yeah, volunteering is definitely a big thing. Thank you.
Thank you for that, Richard, and I endorse your comments there. Councillor Crowe, please.
Thank you. I have to say, I'm a bit astonished by the way the working group that used to exist has just been shot down in flames, really. A cross-party working group that brought a lot of benefit to this council, to the staff, to the residents, that did have powers. We discussed things and we recommended them. And the very thing that you see referred to on page 17 in terms of the Eastwood Mental Health Hub came directly as a firm recommendation to committee from that working group. It had clear action plans, and the fact that we have a leader who's talking about wanting to task a specific piece of work, well, bring that to this committee. Let's have a proper action plan. Let's have some buy-in on policy on mental health. Because I'm sorry, this report is fantastic in terms of the information it's bringing. There's been lots of positive contributions that I don't want to undermine, but bring us a proper action plan. Let's have a look at a properly costed out action plan for supporting young men and their mental health. You know, this report doesn't scratch on COVID-19 and what we've learned from about mental health through COVID-19. You know, there's been the mutual aid groups who no doubt could have fed into that. And I just think instead of arguing and people, you know, essentially saying, oh, we didn't like your mental health working group, so we're just going to be negative. Actually, there's a lot of positives that you could have learned, and you did learn some of your members from that. So bring that forward. And on the work, when we get to the working group, I intend to propose that we look at a mental health action plan, because it's not been looked at since you came into control back in May 2018, and nothing really has progressed since then. You talk about it a lot, but there isn't any action in terms of spending on this.
I think
and this, can I just finish what I'm saying?
It's a total misstatement of what we're doing. You can see from the items on this agenda, you can see from the next item on the agenda, there is no restriction on your ability to make comments and to emphasize to us the importance of an action plan. You've heard a lot of things that have been discussed, which have been taken on board, and it is a more powerful committee than a subcommittee would be, a working group, whatever you want to term it. We've dispensed with that. You just, at each meeting, you're using this point, and all right, it's gone, and that's the end of it.
I'm not going to be stopped from talking. I hadn't actually finished when you rudely spoke over me. Well, what I was going to say was...
Just hurry up and get on with it then.
Well, I won't bother then, because it's very clear that you as the chair of this committee clearly have no interest in mental health or investigating that further, because that's very apparent from the crude approach that you've just taken to it.
Statement, and you know it. Any further? Well, Millen, do you wish to comment?
No, Chair. I think that was an awful thing to say, particularly about you, and it's totally unnecessary. We consider this to be of primary importance to warrant committee status. And the action plan that we'd evolved has been put on hold temporarily while we look at and work with government departments, particularly on looking at the impact on mental health with the health authorities across the whole of the area. And it is undoubtedly linked to things like leisure, to open space, to recreation, to community engagement, and that is causing us a rethink on the whole of our leisure strategy as well. So, Chair, there's an awful lot happening. It has full committee status. I'm not really going to enter any further debate on that issue.
Thank you, Councillor Lewis. Councillor Land, please.
I just find it hugely ironic and rude that the Conservative councillors are talking about this council having to prioritise mental health when today in County Hall they voted in favour to abolish this council. How dare they speak like this?
Well, thank you, Councillor Land. Any further questions on this item?
Just a point of clarification for Councillor Land. The vote was actually just to discuss the future of local government. No decision was made.
Thank you, Councillor Carey. Any further questions? Ruth, you wish to make a comment?
No, Chair.
No, sorry, you just came up and I was pleased to see you. But we'll move on then, if there's nothing else, to page 19.
Thank you, Chair. I'll just say a few brief words of introduction to this report. This is a proposal that came to a previous meeting of the committee, actually before the COVID pandemic happened. And it was deferred for further information about the details of a scheme. In the intervening period, a survey has been undertaken with people living with dementia and their carers. 75 people participated in the survey, and many of those people actually live in our area. The report outlines some very sad reflections from those individuals on how they have found life to be like for them under the restrictions that were placed on residents during the lockdown. And I think what it does is emphasise more than ever the need for support to be given to people living with dementia, and as importantly, their carers. Carers are often a group of people who are dedicated, caring, kind, and taken for granted in terms of what they do to ensure people can be supported to live independently good lives at home in their familiar surroundings. What we are proposing in this report is that the councillors consider a small initiative working in partnership with an organisation called Imagine Arts Dem Broxtowe, which is a community interest company set up in Beeston, running out of premises in Padge Road. I know that some councils have had the opportunity to visit the work that they do. It is one of the trustees of the company is a professor specialising in dementia at Nottingham University. It is run by people who really know what they are doing and are basing the work that they do on solid evidence and good research. The initiative that we propose in this report is to simply provide a small amount of financial assistance to people living with dementia or their carers, to enable them to access sessions at the facility, which costs £35 per session. That covers a morning or an afternoon session. One of the beauties of the facility that is offered is that a person who is a carer can bring the person they care for to the centre, and obviously when that person is comfortable, they can leave the person there in the care of people who are properly trained and qualified to give them good care. That then has the impact of giving the carer a break, something which really they have very little of. So there are a number of different benefits to the sort of scheme that's proposed. We do have a budget of £10,000 for mental health initiatives in this year. Some of that money, or indeed all of that money, could be dedicated to support this initiative, should members be minded to do that. Thank you, Chair.
Thank you, Ruth. Now, I'd just like to add, and fair play to Councillor Shane Easton, he did ask us to look a little bit more carefully at the allocation of funds, and Council and myself actually visited the studio where the activities take place, and it was impressive. And you walk in, it's obviously carefully monitored, and you have, whilst it's a studio, a warehouse, it's there are 3 different rooms effectively built in it where people can have one-to-one conversations. But the thing that I remember most of all about being there is while we were being shown around, a gentleman walked in, obviously a little bit confused, but he was known by the staff. And they greeted him and asked him what he was doing there. He wasn't altogether sure what he was there for, but he is one of their clients. That to him was a sanctuary to which he could come. And it was the place he went to when he was obviously somewhat confused. The other thing which surprised me, and I hadn't appreciated before, is how you can have a there were two other people there who were clients, and Hannah and I spoke to them, and they were quite open about the fact that they suffered from dementia, and they were able to speak and rationalise it and indicate the things they could and couldn't do, the sort of problems which they came up against. So to me, it was a real eye-opener, and thank you, Shane, for making me get up and go down and have a look at it. And I really hope you all feel able to support this endeavour. I think the other thing that's also good with the coupon system, I think there's an illustration for those of you who've got a copy of it. It's simple, it's straightforward. You can either take 10 or 15 pounds out and make up the difference. It's a simple system. It's a community interest company, and as the principal officer said to me, the professor whose name sadly slipped my mind at the moment, she said, well, of course, with hindsight, we would have realised it would have been better to go straight for full charitable status, which are in the process of doing. In terms of justification of expenditure and how that can be monitored, well, CICs, like charities, have to produce full accounts, and everything has to be specifically laid out. And I had a chat with our chief audit officer, and he said it said normally for amounts under £5,000 they would probably do a cursory check, but above that they can check in more detail. But their accounts are a matter of public record, so I have no doubts that the funding will be strictly monitored, and we can be satisfied that there will be, as Nick said, no misappropriation. I'm sure that wouldn't happen, but there are proper accounting procedures in place. Therefore, I would recommend to committee that we support this. Do I have any comments from other members? Hannah?
Yes, please, Chair. I'd just like to echo the things you said. Obviously, we both managed to get to visit the facility shortly before lockdown occurred, and I during lockdown was reflecting how much the service users would be missing out, and the carers of the service users on that facility, because of course at the advent of COVID it had to stop in its physical form. I absolutely support this recommendation. The value, we can't underestimate the value that this will be bringing to not only people with dementia, but the carers that support them. I know I mentioned at the Leisure and Health Committee in January about my own experiences of dealing with dementia. Both my grandparents had it, and then sadly my mum had a very specific form of dementia which is difficult to diagnose, which also came along sadly with motor neurone disease. And it was only because of the motor neurone disease that we were able to access the support of the hospice service that was wonderful and marvellous, and my mum was able to access day support there to go to use their services once a week, which was able to then give my stepdad, who managed to care for my mum at home until her dying day. She did die at home in peace, thankfully. The value that brought to him in just spending half a day being able to get jobs done, being able to rest and know that mum was well looked after, and was getting, she got great joy out of the activities that were going on. What we're missing here is that my mum was able to access that service because of the diagnosis of motor neurone disease. A diagnosis of dementia itself on its own puts you under a different pathway, which means you're not necessarily able to easily access services such as the hospice. So a service like this, providing support and activity for dementia sufferers and their carers if they want to join in, but also the opportunities for the carers to have the break. That holds tremendous value in terms of health and well-being, and thinking about the wider cost implications to our health services as a whole. It has the potential to reduce hospital admissions, all sorts of wider implications. I wholeheartedly support this recommendation. Thank you.
Thank you, Hannah. Do we have any other questions or comments?
I do, Chairman, if that's okay. I did indicate in the chat.
Yeah, it's not showing up, Eric. I apologise for that.
I would like to support this. I just wonder if I could ask a couple of questions. I don't see Appendix 2 in my papers. I'm not sure if I'm missing them. I only got my papers online because I'm a latest sub for Halima today. The other comment is, I think it's important to understand how good something is or not, and I think it's very useful that we will be getting feedback, hopefully feedback from the users and from the carers. And I just wondered if there could be a link or something put on the form where they could go, or so they know where to say, you know, how much they enjoyed the service, or you know, think it's a good service, or any ideas where it might be improved. So with that in mind, I just like, I'd like to support the move.
Thank you, Councillor Kerry. I'm sure we can ask that of the studio, and as you say, feedback can be useful. Shane, I think you're next.
Thank you, Chairman. Yeah, absolutely support it. Thank you for going and having a look. I'm pleased we were all, you know, happy with that you reported. It's a very worthwhile cause. I think the one comment or the two comments that come out of it, I think, does it still work the same now? I'm not saying we defer the money at all, but does it still work the same during the COVID situation? If not, are they doing something at the minute? And the other point is, and I probably asked this, I probably know the answer. Is this is open for Broxtowe residents? Is that right? This money will be for our residents. It's not, you know, you've got to be a resident or a carer within the borough, presumably. Or a little bit of clarification on that if possible. But absolutely support it. So thank you very much.
I have Ruth waiting and then Millen to follow. Ruth,
yes, Chair, just to confirm, this is for Broxtowe residents. Anybody who lives in Broxtowe will be eligible. In terms of Appendix 2, that is actually the voucher system. So apologies that that heading wasn't on that page. Yes, we can provide the necessity for the company to give us feedback in relation to how useful the customers find the service, there was another question that oh yes, how the service is currently being used because of the COVID. Clearly, it did stop for a while there was lockdown. I am told they are beginning to operate again. Obviously, there are quite strict precautions that are being taken. It may well be that the number of people they're able to take is reduced, and therefore the numbers that we might have been expecting to use the service may be not as great as we might previously have expected. They are, you know, opening slowly, I understand. However, I know they will be grateful for the assistance provided by the scheme, and we will report back to you on the numbers that are using the service as and when we have that information. Thank you, Chair.
Would you like to come back next, Eric? I think you were asking a follow-up. Is that correct, or am I wrong? Did you have a follow-up question? No? Okay. We'll move over to Councillor Radulovic.
No, Chair, the Chief Executive's answered the questions that were raised more than adequately. I'd like to support the initiative, and hope all the board members will, for the full £10,000 when we make the full allocation.
Thank you. Do we have any other questions before we move?
Yes, I'd like to speak, Chair, if I may.
Yes, please carry on.
Yeah, I'd just like to support the report, and I actually found it a really good report with evidence, particularly in this summary survey of what actually was required by both dementia sufferers and carers. But particularly in this report, the focus on carers is actually commendable, because often the health service provides care for the sufferers, but not for those and the families of those who have to look after them. And perhaps that's one of the issues that, in the previous report that we spoke about mental health, it's often the families and the carers who often suffer and really have little access. But my other query was an issue raised by Councillor Land about access to these services, whether they're through the medical pathway or the social care pathway, and in fact, is there a significant difference in payment in both those pathways? Because I guess what I'm really asking, is this sort of free and open to everybody, or might, as Councillor Land suggested, there be different factors involved, whether you're on a medical pathway or a social care pathway? Thank you.
Thank you. I'll ask Councillor Land just to come back and see if she knows before going back to Ruth. So, Hannah.
Sure. So, in my mum's case, because of the physical diagnosis with motor neuron disease being a terminal and palliative illness, we were able to access funding through the NHS to support her care. So her care at home was funded by the NHS, which you wouldn't necessarily get with a person suffering with dementia. They would have access to support from social care, possibly, which would be means assessed on the basis of their income and their savings and so yeah. So, and also we know that there is a disparity between funding for the NHS and funding for social care. We know that councils are cash strapped across the country, including our own, although we don't have a direct input on social care provision. We know how cash strapped our county council is, and so that means access to services is limited, and there is a disparity for people with dementia in terms of accessing services, which is why something like the services that the studio and other services like Middle Street Resource Centre and Eastwood, that is vital in terms of supporting people with dementia. Thank you.
Does that answer your question, Trish?
Yes, I guess what I probably need to ask our Chief Executive is, where's the funding behind this organisation coming from? Is it from the medical, or is it from social care?
Yeah. Well, the funding comes from mainly from the fees that are charged for the sessions.
Yeah.
So it is a business in that sense. I did ask them if they got any support from adult social care, and they said no. So I think that is a reflection of how constrained those services are in terms of funding, and it's a sad reality that that is the case. However, I did send out, this is what I was going to say when Councillor Tyler invited me to come in at the end. I did send this report, particularly the survey, to the Director of Adult Social Care at the County Council. And she replied to me that she found particularly the survey very interesting, because it does provide that data on the experience of people living with dementia during the COVID time, the lockdown time. And she said that she would put this on the Health and Wellbeing Board for discussion. I did suggest that she invite Justine Schneider, who is the professor who undertook the work, actually to present the report herself, and she is in fact a resident in Broxtowe. Thank you, Chair.
Yeah, I'll just add to that. There's a bit of background. I discovered when we were down there that the owner of the premises, a businessman, I believe the first year was rent-free, but thereafter it's a peppercorn. So that's a significant area of support for them, which has enabled them to progress their endeavour. Okay.
Please, Chair, Pat,
Yep.
I've indicated I would like to speak.
Yeah.
Yes, again, you're correct about that. Home Instead, in fact, own the building, I believe, and they are a private concern. But I know the director of that is quite community focused. But I would just like to say that I mean, speaking up on behalf of maybe Janet Patrick, who isn't here tonight. I mean, she's very heavily involved in the Memory Cafe, which does provide a degree of respite care to the carers and to those suffering with dementia on a very regular basis. Again, at Middle Street Resource Centre, and this is a very valuable resource that members, if you need to signpost anybody for this sort of support, that is available as well.
Thank you, Pat. Do we have any further questions? In which case, I ask the committee to resolve their support for this proposal as shown. All those in favour, please.
Sorry, Chair.
Yeah.
Could I just have a proposer and a seconder, please?
I wasn't quite sure whether the resolution was the same. So I'll propose.
I'll second it.
Chair.
Thank you. Councillor Sue Bagshaw.
For.
Councillor David Bagshaw.
For.
Councillor Crowe.
For.
Councillor Eason.
For.
Councillor Stephanie Kerry.
For.
Councillor Lally.
For.
Councillor Land.
For.
Councillor McRae.
For.
Councillor Marshall.
For.
Councillor Simpson.
For.
Councillor Tyler.
For.
Councillor Eric Kerry.
For.
And Councillor Roberts Thompson.
For.
That's carried, Chair.
Thank you very much, Jeremy. Thank you, councillors, for that support. Right, we'll move then to our work programme. I think we've had plenty of suggestions this evening for items to go in there. So can we just look at that, and would people like to raise any comments or suggestions within the context of this suggested work programme?
Hi, could I come in if that's possible?
Yeah, you can. I'm sorry, I'm not seeing people come.
No, you did. To me, I'm that slow at typing in. By the time I've typed I want to speak, we've about finished the article. So I'm shouting if you don't mind. Thanks for putting up with me on that. Okay. Just on the works on the committee, and I know it's been a bit feisty tonight, so this is not meant. I'm not having a dig here. We've got the legislative strategy report that's coming to this committee. Now, in light of the fact that the other report is going to policy performance, all I'm looking for is, will we have an assurance, I am on policy performance, but not all people will. Anything that is relevant that takes place at policy performance, can we just have an undertaking that we have, you know what I'm trying to say, that we've got all the relevant information, as some of this information seems to be going to one committee. Will there be sort of a binding report that will explain everything to us that's happened at policy performance that ties in with the leisure strategy report? Does that sort of make sense?
I understand what you're saying, Shane, and it would be my hope that that would be the case, but we have to be mindful that if the negotiations are still ongoing, there may be elements which are, well, one of them commercially couldn't be published. I don't know if Zulf would like to make a comment on that, if he's still with us. Zulf, are you there? Evidently. Oh, there he is. Yeah.
Hi, everybody. Can you hear me?
Yeah, we can hear you, Zulf.
Right. So I think that there's 2 points. Firstly, I think the reference to the work plan leisure strategy is a mistake. It shouldn't be on the November agenda. It's on the policy performance committee. It shouldn't have been on there. What was the other question you raised, Chair?
Well, it's about disclosure of information, and the point I was making was that there may be some elements which it wouldn't be appropriate to release.
Just to help you, in terms of the report going to Policy Performance Committee, we take legal advice to make sure that the context of the report are permissible in a public arena. So what we did back in June, there was significant information around the financial picture, revenues and costs for our company, and therefore the legal view was it would not be permissible to have that report presented in public, and we took it in private. In terms of the full leisure facility strategy produced by Continuum, the advice I've been given from our lawyers is that report is fine to be viewed by the committee in public. There's no commercially sensitive information there around our company, and so we've got the green light for that particular report and agenda to be covered in public session.
Thank you for that, Zulf. Does that answer your question, Shane? Councillor Eason, did you?
It does. I think it does. Yes. Yeah. Thank you, Ian.
Right. Any further comments or questions?
Please, Pat, Councillor Ali.
Yes, Pat.
Could we possibly, at one of the meetings, seek a little report from some of the voluntary organisations providing support in the area for mental health, to just ask them for a brief report on the current state of play with their organisations, just to keep an eye on them?
Yes.
Could I make that a proposal?
Yes, if that's proposed, I'm happy to second that. Voluntary organisations. Is everyone in favour of that?
I think Chair, what I was going to ask was if we could have on the next agenda an update from Sally Bestwick with regard to the Eastwood Mental Health Hub that we obviously contributed money to, and an update on the Mental Health Action Plan. So might incorporate what Pat's just said.
I think that's a good suggestion. Are we all happy with that?
I'll second that.
Seconded by Eric Kerry. All those in favour of that?
Yeah, it's fine with me.
I'm a yes, so I think, yeah, that's resolved, so we will have that. And now I have Councillor Radulovic who wanted to make a comment, then I'll come back to you, Trish, if I may.
Chair, there are the issues of confidentiality regarding the leisure, of course, relate as well to potential other which leisure centre, which ongoing discussions are on with the owners of the premises. So I feel that a brief explanation to Shane, to Councillor Eason, that report is subject to commercial confidentiality at this point as they're making bids to the Higher Education Authority.
Thank you, Millen.
Okay, thank you for that, Millen. Pat, Mel, is there anybody else who wishes to raise a comment or a question?
Just to highlight, Chair, obviously we discussed with Milan a report around male suicide and actions abroad, just to make sure that that's been noted. I think that's important. Thank you.
Thank you. And I think, Trish, have I taken your question, or did you want to ask a further one?
Thank you, Chair. No, I was responding to the previous vote. That was all.
That's all right. I just like talking to you. I just thought I'd pop in again. Okay. Are there any further items to be listed or mentioned?
Can we have a date for the next meeting? It just says November.
Well,
through you, Chair. Muted. Through you, Chair, we're looking at the 25th of November.
25th November. Has everybody noted that on their diaries or their laptops or whatever?
And also, Chair, I've made a list of the various things that have been suggested to add to the work programme. Before you take the final vote, I wonder if I could just read those out for the committee.
Please do so.
We've got a report or reports on suicide data and trends, young people and mental health, local mental health voluntary organisations, an update on the mental health action plan, and to invite the mental health hub to give a presentation to a future committee as well.
Thank you, Jeremy. Everybody, do you?
Yeah, is that an additional meeting from the original meeting list that was sent out, isn't it? I think it's not on the original card you sent, or is that correct, Jeremy?
I've got a feeling, Chair, that through you, Chair, I've got a feeling there is an additional meeting. I think there was probably an error, to be honest, when we set the programme of meetings. And I think that's the case.
Okay.
Please, Chair, I did ask if it could include a presentation from Robert at Middle Street Resource Centre as well, who's very knowledgeable in the mental health field.
Yeah.
Along with Sally especially, or maybe at the following meeting.
I think we might have a lot on to do that in one meeting.
The following meeting then?
Well, yes, we can extend that invitation and see whether that's convenient for her.
For him, yeah.
Okay.
Lovely. Thank you.
Fine. Right.
Through you, Chair, we just need a proposer and seconder for the work programme.
I propose the work programme.
I'll second that.
Thank you.
So, Councillor Sue Bagshaw.
For.
Councillor David Bagshaw.
For.
Councillor Crowe.
For.
Councillor Eason.
For.
Councillor Stephanie Kerry.
For.
Councillor Lally.
For.
Councillor Land.
For.
Councillor McRae.
For.
Councillor Marshall.
For.
Councillor Simpson.
For.
Councillor Tyler.
For.
Councillor Eric Kerry.
For.
And Councillor Robert Thompson.
For.
That's carried, Chair.
Well, thank you very much, everyone. That brings us to the close of the meeting. I shall be off on a week's holiday in Wales from Friday, if I'm allowed across the border. So until I see you in another week's time, a very good evening to you all. Bye.
Good night, Roy.
Cheerio.